Okay, I guess I'm just gonna have to record and I'll just email to you. Okay, so this is our group project that will cover topics of social interaction, diversity, learning styles and strategies, critical thinking, goal setting and time management, and mental and physical health management. So when you're socializing with others, you are forming a bond relationship with them. The connections that you make between people can help support you in different ways. For example, college students can visit office hours and ask the professor for further help on material that they're struggling with. For a professional example, if a classmate has an older sibling who has experience in the optometry environment, I can get the opportunity to get job shadowing to learn from my career. Developing good study habits help college students to become successful college students. Wait, developing good study habits can help college students by combining their socialization and studies together. For example, peers can do study sessions with one another to help each other understand the course material for any exams from their classes. Socializing can minimize stress for some people. When you share your struggles with others and family members, it can help lift some of the weight off your shoulders. In return, they may help find strategies and give advice to help reduce stress. As an optometrist, you are constantly dealing with patients. It can become stressful at times. It just all comes down to how well you can manage the stressful situations. There are coworkers within your environment that you can reach out to when handling the stressful situations. Same goes for communicating with peers in the college environment. By sharing interests with others, you can learn something new and create new bonds. Everyone that shares their interests expand their knowledge and experience their social interaction. When engaging with others in either the academic or professional environment, you get the opportunity to observe how people act. You may observe behaviors in others that you would like to further engage with, or you might see ones that you would like to avoid dealing with. The observations help strengthen your social skills and helps you realize how well you are able to handle yourself in social situations. I am also going to talk a little bit about interdependence because it just mentions the importance of connecting with others, using social skills, and forming relationships. In college, interdependence is one of the key factors to success because when you become comfortable engaging with others, you are more likely to help others succeed as well. For example, if you have a firm understanding of a concept from a lecture class, you can teach it to others, to those who are struggling with it. It's mentioned in the textbook that students who succeed have developed relationships that support themselves and support other people. They also develop a network of friends and family members, professionals, and others as a support team. These individuals also actively listen to others as an action of support. They demonstrate a sense of sympathy and compassion for others. As a subtopic, I chose diversity because this topic is important to consider when interacting with others in society. My definition of diversity are the qualities and cultural backgrounds that set people apart from one another to make them unique individuals. Surface level diversity is what we observe when we interact with others. These include ethnicity, race, gender, age, etc. Unfortunately, this can lead to bias and discriminated thoughts toward individuals. For example, when people find out that I'm a Muslim, some of them immediately make fun of me or get disgusted and label me as a dangerous individual because they have a fixed mindset that all Muslims are terrorists. Deep level diversity are things that define a person that we are unable to physically see until we form a bond with the individuals. These include personalities, attitudes, beliefs, and values. Once once individuals gain understanding of how a person behaves, they eventually focus less on the surface level features and more on the deep attributes that defines a person. For example, once people find out that I am genuinely a nice person, they overlook the fact that I am a Muslim and treat me as an equal. On a professional level, when interacting and communicating with patients in the field of optometry, it is important to acknowledge that everyone is unique and different and should be treated equally. It is important to be considerate of their social and ethnic backgrounds and engage with them in a way that makes them feel comfortable. This also applies to the academic level as well.
So the learning process is how we assess, understand, and absorb information. And there are 4 stages to complete this process. We start with the state of unconscious incompetence. This is the simplest level, which is identifying what you do not know and expressing an interest in learning further. This is a crucial stage to complete in order to point you in the right direction for assistance. Then we enter a stage of conscious incompetence. This is the most challenging stage because you have already compiled information on what you do not know, and now you have to figure out how much you need to learn. This differs from stage 1 in that we begin by having conversations and expressing interest in new experiences, whereas in stage 2, we apply new skills that contribute to reaching your learning goal. I will use conscious incompetence to learn new abilities that will help me achieve my learning goal, such as incorporating past orthodontic experiences into future procedures. Stage 3 includes mastering some aspects of the learning goal and feeling secure in your abilities. This leads to stage 4, where you have effectively practiced and repeating the learning process to the point where you can achieve your goal without even thinking about it. However, to feel like a master, you must continue to practice and reevaluate stage 4.
And the subtopic I'll be speaking about today is under thinking and analysis, and it's critical thinking. People who are critical thinkers are typically inquiring and thoughtful, and they like delving into new areas in search of information, explanation, and new answers. They ask important questions, assess claims and arguments, and differentiate between facts and opinions. Critical thinkers are willing to question their own ideas with a demeanor that permits them to confess when they lack information or understanding, and they're willing to change their minds. As the slide shows, critical thinking is skepticism, examining assumptions, challenging reasonings, and uncovering biases. And critical thinking is not memorizing, group thinking, or blind acceptance of authority. And the career path I would like to go in is forensic psychology. And in forensic psychology, it is crucial that I employ critical thinking to enhance my own knowledge, since I'll be working with criminals and their mental and thinking process, which is significantly different from that of a normal mind or conscious.
When it comes to goal setting, long-term and short-term goals can be very important. A long-term goal can be graduating with a bachelor's degree of your choice. A short-term goal can be setting up a daily routine. Setting goals can be difficult. Coming up with a support system can be beneficial to maintaining your goals. A few examples of goal supporting is meeting new people, becoming involved in your community, having a positive attitude, and congratulating yourself on what you've done to get to where you are. Time management. 3 important steps to improving your time management is to identify your style. Are you the early bird? Do you make to-do list and get started as soon as possible? Or are you the improviser? Do you get things done last minute and turn assignments in late? If so, how can you improve? Create a schedule to help balance out your work/school time with your personal life. Finally, prioritize what needs to be done now and what can wait for another time.
Mental and physical health management. Nutrition. Nutrition is the process of providing or obtaining the food necessary for health and growth. This is necessary in college because most college students tend to eat junk food because they don't have the time or they don't have the right knowledge to know what type of food to put in their body. According to the book, there are 6 type of things that we need to know to maintain a good health. First one is making sure your plate is mostly fruit and vegetables, making half your grain whole and making half your grain whole grain, vary your protein routine, move to low fat or fat free milk or yogurt, drink and eat less sodium, saturate fat and added sugar, and eat the right amount. Then we go to exercise. Exercise is important. According to the book, getting an efficient exercise routine now will not only make it easier to build healthy habits, but you can take with you into your life after college, but it can actually help you be a more successful student too. Sleeping can help one with having a lot of energy, better decision making, improving memory, abilities to manage stress, and improving physical health. A person should get at least from 7 to 9 hours of sleep every night. The difference between falling asleep and getting the right amount of sleep is falling asleep is more you were for example, if you're using your phone at the time, you will be falling asleep because you're tired. Getting the right amount of sleep is having a schedule and sleeping on time. Substance abuse. Most people do drugs because they think it feels good, because they want to stop feeling bad, and because they want to do well in school or at work. But what they don't know that it affects their body and brains in multiple ways. When it comes to cigarettes and tobacco, it affects and if it affects more in the lungs. And when it comes to alcohol, it can make one go into a coma. It could create injuries, stomach cramps, and skin rashes. For effects on meth, it makes physically, it the person gets nauseous and feels hot and cold. And mentally, they have self-confidence and they're more aggressive. When it comes to heroin, a lot of people tend to feel a lot of pain. They itch a lot and they are disoriented. Stress. Stress is caused by many things, but we could one way we could control that stress is by making daily routines, such as listening to music, going out, walking, sleeping on time, eating the right food. When it comes to mental health, a lot of people don't know what it is, but mental health is a condition with regards that their physical and emotional well-being needs to be worked on. Mental health is important because without it, there are many symptoms that could be bad for a lot of people. Such examples are eating disorder, loneliness, depression, suicidal behavior, and anxiety disorders. Sexual health. Sexual health is important because we need this in our life, because without it, we could get sick. For example, getting STDs. There are different types of STDs. There's chlamydia, genital herpes, gonorrhea, HIV, HPV, and syphilis. One way that we could protect ourselves from getting STDs is by getting tested, using condoms, or get vaccinated. Another thing about sexual health is when people get sexually assaulted. One way that you could get help is calling 911 or getting a trusted friend to take you to the hospital. Lastly, we will talk about safety. Learning about your college safety or anywhere in the field, you need to understand what's going on around you, what type of things that you need to do, and you need to take precautions about the things that you might need to do. One thing that the book says is we need to stop, think, and then act. Lastly, this can help. Mental and physical help is important for my career because being a surgeon takes a lot out of someone, especially eating the right food so you don't faint during a surgery, or take or getting the right amount of exercise or sleep so you could stay healthy.
All right. Thanks for listening to our group project.